To accept my invitation, and we are live in YouTube and in Instagram.
Okay, do I have to enable the micro access on Instagram as
Yeah,
well?
yeah, doctor.
Okay, here we go. Okay.
You got it?
Yeah, got it.
It's gonna work. Wait a minute. Waiting, Dr. Elmar, enter to talk with us today. Just a little bit. Do you accept it, doctor?
I did.
Yeah. I think soon you are online in Instagram too.
Okay, great.
So, okay, let me see. Okay. Almost here. YouTube. Okay.
Hey, yeah, wonderful.
I need to lower my audio. Hi. Hi, everyone. We are here today with Dr. Elmar Jung. It's that so? I met him at my last seminar in Munich in December last year, and with Dr. Lightner. We are learning more about biological dentistry and removal of and surgical removal of interference fields. And we will have the Congress online, International Congress of Osteoimmunology, Maxillomandilbular, in next week. And so far, we are talking about colleagues around the world about this approach of treatment, this line of treatment, and more integrative, more biological. And today we will talk to Dr. Elmar Jung. And Doctor, tell us a little about yourself and how you're beginning in this dentistry and biological dentistry. Hi, Dr. Elmar.
Hi, Reagan. Thank you very much for having me on your talk and as a pre-conference talk for your seminar or conference. So, yeah, how did I get into biological dentistry? That was actually very early when I was at university, when we had to do amalgam fillings. And so I then thought that can't be really right to put mercury in people's mouth. And from then on, I embarked on a journey to see what there is else that can be used for fillings. And that then led me into all these kind of biological dentistry, which also showed me that the main approach of medicine and dentistry is actually a very symptomatic approach, rather than looking at the whole person to see what else there is going on. Because at the moment, still, it looks like dentistry is quite separated from medicine. And so what we need to do as integrative dentists or medical practitioners, we need to see our entire patient. We need to see where he comes from, what is his story, so that we can make good decision together with the patient to move forward in his treatment. Because a lot of the patients, they come to us with a long story. They have suffered for many years or even decades without really having got help, spent lots of money, suffered quite a big deal. And so I think it's very, very important that we dentists, that we are well equipped with our new knowledge that we gained over the years, that we then can really sit together with the patient and discuss what the reason for his problems are. And very, very often those problems start in their mouth. So we see root canals that are infected, we see implants that are infected, or areas where wisdom teeth or other teeth have been removed. that those areas are not looking really good on the X-ray already, and sometimes they don't look. You don't see anything on X-ray, so we need other devices to help us with our diagnostics and to give us the right information to make a proper decision for our patients. And so year by year, I went to different training courses, met with different people like Dr. Lightner or Dr. Graham Munro Hall in the UK. And so, yeah, you learn by doing in the way, because unfortunately, nothing of that is taught at university. We don't even really learn much about nutrition, which from my point of view is one of the basics for staying healthy, because if you have a healthy gut, then there's very unlikely you also your capability of healing properly after a surgery is, of course, much, much better once you have a healthy diet. So that is, in a way, how I came to biological dentistry. On the way, I became a naturopath and did courses with FX Meyer, which helps with the diet and the supplementation, the detoxification, because all these areas are important to look at our patients. We can't just start the surgery and hope for the best. It's very important to prepare the patient. And the first thing here is to really look into his diet. What is his diet looking like? What can he actually keep eating? And what would be best to avoid? So oftentimes that brings the patient to a real lifestyle change. And I think that's a very important thing. It's also important that the patient realizes that it's his responsibility and that it's only him that can actually heal. We as doctors, as dentists, we provide in a way a tool for him that he can use to then become healthy and whole again, but it's really the patient's responsibility to do his best to get there in the shortest possible time. And what we also see, and that comes more and more, is that we have to have a look at the emotional state of our patients. Because when we know that teeth are connected to organs, and those organs are then again connected to different emotions. So kidneys, for example, fear, anxiety, or the large intestine in a way with holding back instead of letting go. So if we can then see on which tooth, for example, they have a root canal that is infected, we can then also look into those organs, whether those organs actually work properly, and also give him an information about the emotions that stand behind it. So as I said in the beginning, it's very, very important to look at the patient as a whole, as an entire person, rather than acting for any symptoms. Yes. Absolutely.
So these are many ways to see these connections and not see the mouth as a part isolated of the body. Né?
Absolutely, yeah.
So in December, you tried do you use Cavitau on me? I was your patient.
Yes.
Dr. Lightner office, and you use Cavitau right now. What's your experience with Cavitau and removal of FTOT and your patients?
Well, I have been using, I would say, or let's put it that way, the predecessor of the Cavitau, the Cavitat machine that was on the market for quite a long time. And I was fortunate enough to work with one of the pioneers of holistic dentistry, Dr. Graham Munro Hall, and his wife Lillian in Bedford for many years. And they had one of the few Cavitat machines in the UK, actually the last one that was actually working. And so I already got used to this ultrasound machine and how it can help detecting bone density, can help detect the problems of X-rays, because oftentimes on X-rays, whether that's an OPG or a CBCT, we just don't see those reductions in bone density. So we don't really know about the quality of the bones. And those ultrasound scanners, whether it's the Cavitat or the Cavitau, they're really, really helpful to give us even more information and make a proper decision then. And the Cavitau, obviously, which is the latest development of the genius Dr. Hans Lechner. And yeah, it just is so much easier to use. And it's also a way of, I would say, compared to the Cavitat, more precise in its results. So I use it with all the patients where we're not sure whether there's a problem around implants, whether there's an issue in root canals, and especially when, for example, sometimes root canals, when you do the orotox test, the toxicology test with the teeth, if that is rather low, that would give an indication that there's no real need to have the teeth removed at the moment, because there is no much toxicity coming out from the teeth. If you then do the Cavitau and you see that around the teeth or the root canal treated tooth, there is a reduction in bone density, that gives you the additional information to make clear to the patient that there is actually a problem with that tooth, despite the fact that the tooth at the moment doesn't show very high toxicity rates. So the more information we can gather, the clearer our diagnostic becomes and the safer our diagnostic becomes, so that we really take those teeth out that are important to take out, that we know they influence our patient's health. And with everything, there are patients who can smoke 40 cigarettes a day and they live until they're 90, 95. And so it's the same with root canals. Some people just can compensate, and others, they don't. They really go on a downhill track, and no one really looks at that. So we need to make sure, and this is again what we as integrative dentists or medical practitioners, we look at the entire person, we look at the whole, we look at whatever brought the patient to there. And in my case, I see mainly chronically ill patients. So we can almost for certain say that the root canals are not a good thing for them, because even if at the moment they are not toxic, they will still play a role in their immune system, which means it takes a lot of the capacity of their immune system to compensate that kind of foreign body.
Oh, great. You have the Orthox and Cavitau available in your day-to-day clinic. It's a dream for us here, but in Brazil, you hear, you know, and Orthox with some some colleagues use Cavitau. We don't have yet here, as some colleagues don't know even exists, and that's great. For you to use all patients. No, it's a high level of diagnostic.
Well, we have to say that we don't really diagnose with a Cavitau. We get some more information, so we get the bone quality, we get the bone density, but we would never say we diagnose with the Cavitau. It's an additional tool, a very important tool to really make sure that we see what we need to see to make the right decision. So all those tools, Orotox, Cavitau, Rantis tests, and what else we have, that will then together create the information for us in combination and together with our patients to make the decision what to do.
Do you have a confirmation about, do you see at the 3D exam? So do you have your anamnesis, your interview patient, and we need only 3D exam. And 3D is not a complete diagnosis for us, but I think, do you have these tools to combine it? It's more easy, confirm it a little disturbs systemical or interference in fields and mouth. Yeah.
Well, what I use mainly is the OPG, because it has far less of an radiation impact on the patient. And so the 3D, yes, it's a great tool. However, that's the reason why we have the Cavitau now. So with the Cavitau, we can actually get the results that we need without harming the patient, because it's without radiation. So Cavitau is totally harmless for the patient, because the ultrasound that comes through the bone, that doesn't interfere as the radiation does. And so what I do with a 3D is, when a patient comes and, for example, I had this week, he had a tooth extracted and they left a part of the root in, and that was very close to the sinus as it looked from the 2D OPG X-ray. So I then sent him to have a 3D scan to have a closer look, to exactly know where I need to go in to get the root out, rather than creating a big trauma by opening up all sorts of different areas to get to the root. So in that case, yes, I do that. And probably if colleagues, and most colleagues do implants, if they do implants, then they obviously need the 3D for their planning. But I'm not doing implants. I don't place implants. I don't do, no. And the reason is probably due to, I see mainly chronically ill patients, and it takes them quite a long time to become healthy. And so I don't recommend for them having teeth out and straight away implants in. I mean, we're not talking about titanium implants. We talk about zirconia, any kind of implant that are not metal. It's just, I think that my patients, they should first heal before they get another impact of a foreign body that their immune system needs to deal with. And I think also, when you're healthy, you can compensate a lot of things, even implants. And it's a great way of restoring your bite. I'm just more on the cautious side. So I want the patient to be healthy. And if I then need to give some recommendations where the patient could go, then I send them to colleagues where I trust that they do a good job. And most of the times I send them to Munich.
But ceramic implants, do you recommend, or even ceramic implants
Well,
Any kind
yeah,
of
if someone wants an implant, then I would only say ceramic ones, because we know now from many different researches that titanium implants already, when they are placed into the bone, there is kind of a friction, and parts of the titanium will go into the bone. And so I don't think that titanium nowadays is state of the art dentistry. And if we look into everything what's going on with Wi-Fi and 5G, these kind of things, I mean, you're an antenna then, having metal in your body, and that's not only in your mouth with implants, that's everything from hip to shoulder plates or whatever metal you have in your body. So I would always recommend to go for zirconia implants.
the metals is a problem, and the titanium is a controversial subject, and it's divided in all opinions of dentists. But for us, we have uh, patients with systemic disease and chronic complaints, and we for us it's obviously that
Yes.
the titanium don't fit at our treatment now. But for other colleagues, it's okay, it's fine. But I think for this kind of patient in this approach, integrative, and it's different for us. It's different.
Yeah, we also need to look into that oftentimes, and that's the same with medication that patients get. If you have one metal in your body, it's a different story than you have a titanium implant, where you have a gold inlay and you have a metal bonded bridge. So you have three different metal alloys in your mouth. And then obviously you have a battery effect, which means there's even more coming out of those different metals. And so therefore, we really need to look into that very closely before deciding that the patient gets anything. And therefore, again, zirconia implants definitely the choice at the moment.
Yeah, at the moment, we don't know in next 10 years.
Well, we're still waiting for them to develop just the stem cell planting in, and the tooth grows like a little flower grows.
Yeah, who knows? In next years, a lot of things change, and
Yeah.
so becomes better.
Yeah, we need to talk to Dr. Lechner, because he's always at the forefront of that. So maybe he has something on his under his sleeve.
He always a many years
Yes.
in front of us with your ideas is great. I really admire Dr. Lecter. Dr. Lecter will be a live interview next week, answer questions about FGOD and eco and
Yes.
cavitations. It will be a lot of questions for him.
Absolutely. I believe that he will be inundated.
And we also did the seminal piece talking about biocompatibility and about different types of materials of implants,
Yes.
and how that's affected, how that's make changes in tissues around implants, periimplantitis, and periodontics. And we also have Beatriz Lejun talking about immunotherapy.
Very good.
John Roberts from UK too, talking about biological dentistry, with so many colleagues around the world searching and researching for this kind of technology and biological dentistry to bring for us more techniques and basis for our colleagues make more biological treatment.
Absolutely, and I think it's important that the colleagues connect with each other to bring forwards the latest research, and it's also important that we get the message out to our patients, because they are the ones who actually need the information. So from next week onwards, I start a podcast, and it's called Elmar's Tooth Talk, and I talk about all things dentally, about amalgam, root canals, fluorides, cavitations, so that this can really be going there where it needs to be, so that people can get their information before they even cross the door to their dentist, so that they're informed, that they're really knowing already what they can expect, which questions to ask. And so by listening to the podcast, they can educate themselves and become their own kind of home dentist in a way.
You have to put your posts of your broadcasts in Instagram too, with hashtag biological dentistry, safe removal, to people know you more and watch your work.
That's a good idea. Thank you. Yeah, we'll do that.
So I have to thank you for our talk and talking and invite again our viewers to our first international congress online of Osteoimmunology, Maxillomandilbular in next week, and 26, 27, and 28. We are subscribed now and the page. We have two pages. One page is from Brazil, osteoimmunologia.com.br, and for international subscribe, we have osteoimmunologia.com.br _English for you, and you see our speakers. We have 6 speakers from Brazil too. Marta Faisal from Piauí, Brazil, and Dr. Elmar Jung do a great work about mercury. And 20 years ago, he was one of the pioneers of the studies in Brazil. We have this lecture, and David Warren keep talking about mercury too. It's an important
Fantastic.
To warning dentists and patients to take care about mercury. It's not safe. But we need to talk about it.
Absolutely, yes.
So thank you, Elmar, for your talk. It's great to talk with you, to see you again. And you please let a message for our audience right now. And for all you, see you and next week.
Thank you very much, Raven. It was a real pleasure to be on your talk, and all the very best for the conference. And yeah, looking forward to next week. All the best.
Thank you.
Bye.
Bye.
Bye.